So as a nurse and now a researcher who works with people who are homeless, I get asked very often, why is there homelessness in London, Ontario? We have social assistance, we have affordable housing, so why do people still end up homeless? And so what I want to do is I want to look at some of the common conceptions of why it happens and maybe provide a bit of a different answer. So I'm going to look at, are people lazy, are they crazy, or are they hazy, meaning too much drugs and alcohol? And I'm going to break those down a little bit and look at other reasons why we have homelessness. So lazy, homeless people are some of the hardest working people I've ever met. I have a lot of luxuries that make life easy for me. I have a car, I can pop down to the grocery store, I've got money to buy groceries, and so it doesn't take too much for me to get the basics of everyday living. For a homeless person, this is some of the things they have to do. So these are the basic services a person might access in a single day for food, shelter, health, and remember, they're doing this all by walking. So it takes a lot just to survive on the streets. Another thing about lazy is, I've got friends that are lazy, and here's some of the things that they do. And they're lazy, but they still get by just fine. And so there's something else going on, and I've got lazy friends, but it's okay, I love them. So when we think about crazy, yes, mental illness is a huge issue for people who are experiencing homelessness. We know over half of people who are homeless have experienced a mental illness. And you've seen the effects of that for people on the streets living in psychosis and what that does to them and their basic human dignity. Interestingly though, if you look at mental illness around developed nations, the stats on mental illness are almost identical, whereas the stats on homelessness differ from nation to nation. So if it was just the mental illness, those stats would be the same. So there's something else going on here. And it's the same thing when you look at hazy. Addictions are a big issue for people who are homeless, or approximately a third, which is interesting because a lot of the prejudice, we think it's more than that. But you see the same thing with the addictions being virtually the same statistically from nation to nation, but yet the homelessness rates being very different. And we're talking with millions of people, 0.1% is hundreds of thousands of lives. So if we could change that, that'd be a huge difference. And so what causes homelessness? I would say it's not about laziness, it's not about mental illness, it's not about addictions. Homelessness is about public policy. So this can be social policies, housing policies, health policies, and these are what create differences in homelessness from one country to another. Looking at a couple of examples of these, housing we know got dismantled in Canada in 1993, almost impossible to get into affordable housing these days, 8-year wait lists in Toronto, 2 to 3 years in London. Mental health care system that was deinstitutionalized from the 60s on till now, moving people into the community for their mental health care without moving the funds from hospital to community to follow them. So you have people dropping out of the system and ending up on the streets. The criminal justice system, a lot of people who are homeless have had experience with that in the past, and looking at what that system does to people, whether we're actually rehabilitating people like we claim to be doing, or if we're doing more harm to them and to their futures. Same thing with addiction service in terms of wait times. You're looking at a 3-month wait time to get into rehab, and when someone who's addicted decides they want to get clean, you want to get to them right away. You don't want a 3-month wait in which a lot of different things are going to happen in their lives. For youth, the biggest cause of homelessness is people leaving an abusive home, and that's physical, sexual, emotional abuse. And so we need to come up with different ways to support youth so that when they flee violence, they don't end up fleeing to the streets, where they experience more violence. Social assistance rates have not been keeping pace with inflation, and we know that this is one of the biggest causes of the growing gap between the rich and the poor in our society, which is the #1 indicator for the health of a nation. And so we heard about the residential schools, the terrible history in our society with colonialism, residential schools, but still today with the extreme and blatant racism in our society towards First Nations peoples. So what I would suggest is that homelessness is a policy issue, it's not a personal issue. And I would say that we actually choose to have homelessness in our society by the policies we create, by the politicians we support, and by where we put our time, our passions, our votes, and our interests. And we can actually eliminate homelessness if we have better social and health policies. So what are we doing about it? We've got a little community group together that are interested in health and homelessness, looking at grassroots ways that we can improve our community. If you're interested in getting on board with that, or even just talking to me more about it, I'd love to talk to you. Please connect with me, and we can learn more about the most disadvantaged people in our city. Thank you.